Welcome to Something Positive for Positive People. Quick cut to the point. I am getting tested. Yay. Rob, what's your title?
I am Prevention Services Coordinator.
Okay. Rob is a Prevention Services Coordinator here at Pivot. Is testing. Just testing.
Just testing. That's
Pivot testing. We're in Portland, Oregon. And yeah, you're about to hear a bunch of random sounds in the background and unnecessary dialogue just so that you can kind of get a visual along the way of what this process looks like. And I'll be randomly recording videos throughout too. So if you follow the Courtney Brame _ Instagram account or the Courtney Brame _ TikTok account, you'll be able to see this at some point. You know how much I hate reels and social media algorithms and shit like that. So you know that this is something that I care about. All right. So.
All right, so welcome to Pivot. And today we'll be administering HIV and Hep C testing correct right now. So Hep C was not a common test to be put in with the routine, but since Hep C is on the rise, they decided to test everybody rather than IV users or high-risk people.
Oh.
So we suggest that you get tested once a year for Hep C if you're not high risk. And then we'll also do the HIV today as well. And both of them consist of finger prick. I will use the same finger prick for each test. And HIV right now is going down. And this test here is a 4-week window for HIV. So if you had exposure, you would wait 4 weeks from that date of your thought of exposure to get just HIV test done.
Okay.
Yeah. Right. So we will start off with the finger prick.
Is Hep C on a standard panel?
It wasn't until recently because of the high of that being a rise right now.
Okay.
It has gone up like 122%, where HIV has gone down. Right. So yeah.
That's really good to hear. So HIV is going down because more people are getting tested, finding their status early, and then able to get onto medications.
That's correct. Yeah.
And are people more proactively getting on PrEP?
They are. They are definitely doing it. It's a wonderful thing, and they just recently came out with an injectable PrEP.
Yeah.
So that's great because of people. So you get houseless people who can't carry their pills around. They can't hide them. Can't store them anywhere. Well, now the injectables are coming in where they just go in the office, get injected, and don't have to worry about it. And don't have to worry about carrying their pills. People get pill fatigue as well, so that's another option.
Okay.
All right, so we're going to do this little finger prick here. I'm going to have you put your hand right there, and perfect.
Ow, that hurt so bad. You know, this is the first time that the blood was like coming out without them having to like squeeze my finger.
Oh, really?
Intensely.
You're
Yeah.
well hydrated today, then.
Oh,
thank you for that.
It's hot outside. I have
right.
Yes. Water. Out of curiosity, so you mentioned that the houseless population is now getting. They're able to get the injectable.
They are able to. It just came out, so hopefully the county is working on that. So they should be available to a lot of clients right now.
Okay. Are we seeing more of a shift from now, like HIV just being considered a sexually transmitted infection? Like, is there more talk about this being something beyond that with sharing needles, injectable drugs? Like, how is it being presented now?
Well, right now, with HIV and Hep C, it is more common it is on the rise with the injectable drug use because that has gone up by almost 200% in the last 2 years.
How much percent?
Almost 200%.
Okay, I wanted to make sure you said 200.
Yes, it is. That's why they're required. The CDC is wanting us to do more Hep C testing.
Okay.
Along with HIV testing. But yeah, right now the Hep C is so big right now that we really need to get that under control.
Yeah.
I mean, Hep C.
And how is Hep C transmitted? Like, who's
needles,
vulnerable?
blood, blood, mostly by needles. Yeah. Hep C is curable. There is treatment for it, so that is good. That is new too. So we're working on it.
Okay.
Definitely. You get Care Bears today.
Yeah, let me get that on here. All right, so we just drew blood for the HIV test and the Hep C test?
Hep C test, correct.
Okay.
Now
this is a rapid test, right?
Right, they have 20 minutes to get the results on.
Yeah.
So we will put these aside and let them bake.
So what I noticed is, like, at my primary care provider, when I asked for the full STI panel, They drew like 4 different vials of blood. Why are they not just pricking my finger? Is this a resource thing, or is this
For them, for doctors and hospitals, some do the rapid test, but most of them will do a blood test because if there's a confirmatory, if you had a confirmatory today on a finger prick, I would have to do a blood draw to send that to a lab.
Okay.
So they just automatically just do it. So if there is a confirmation, they have enough blood to run more tests on that blood sample as far as like the mutation, what medication would work to that type of HIV strain as well. So
okay,
yeah.
So essentially, this finger prick just tells you if there's a need for further testing for HIV. Is that?
Oh no, it will tell you if you're negative or positive, one way or the other.
Okay.
Correct. Yeah. So and it is the most accurate rapid test out there right now.
Okay.
So yes.
All right.
And now we will move to the question portion.
Yeah, let's do it. This is probably like one of the more important pieces of this because I think that taking a sexual history and like understanding the reasoning for the questions, because there's a disconnect between how a patient will receive the questioning versus how the provider is intending for the questions to be worded. And the first time that I came here and I was tested, like I was like, oh yeah, these are great ways of asking these questions as well. So, yeah, thank you.
It's a risk reduction. It's great. Yeah, I do like that.
All right, let's go ahead and go down the list, Rob. I'm ready.
All right. Are you having any symptoms right now?
No.
Okay. And when was your last sexual contact?
Sexual contact, this morning.
Oh, awesome. Like that answer. And then, what is the following genders of your sex partners? Male, female, non-binary?
Female.
Female? Okay. And then as far as exposed sites, oral sex.
Yes.
Okay. Do you have rectal sex or anal sex?
Yes.
Okay, great. And then we will also do...
I like how you said great.
Great. I love it. No shame here. I love this. I think everybody should be having sex. It's great. Number 6 partners the last 12 months.
Oh, that's that'll be funny content. Damn, a lot.
You can guess that.
Yeah, I don't know, double digits.
Hey, I had 65. That's a good...
You count it. You get to a point I'm like...
Yeah, I actually pulled up their phone and did that too, and they gave me the
Excel sheet
numbers. Yes, there was a girl that does Excel sheet. She does...
shit. I mean, I guess that's great because, like,
if there was exposure, she can go back and go, oh, this day, this person, I need to contact all these people. Yeah.
It's funny, I turned my camera off and forgot we're recording a podcast. I guess that's got to stay in. But yeah, I'm pretty active. So I guess my question is, like, what's the relevance of that question being the way that it's asked?
Just want to know if your risk, it's just the risk of, if the more sexually active you are, the higher risk you are going to be for STIs and everything else. So that's what we're just getting a gauge on that.
Okay. Yeah, you said in the last, how many months?
12, last year.
Last year. I moved to Portland. I would comfortably say 20. Let's go.
That's a great number. All right, and then how would you say your use of condoms and barriers?
Very
Sometimes,
good.
Always?
Very good. Always. Awesome. Let's say always.
That's great. All right. And do you exchange sex, money, or drugs? Or I use IV drugs?
I mean, I take people on dates. Is that? No. No. I don't.
And when was your last HIV test done?
Last HIV test was done, that would have been about 3 weeks ago, 4 weeks ago. Okay. No, actually, 2 weeks ago.
2 weeks ago, okay. Mm-hmm. Let's do it. And have you ever tested positive for syphilis before?
I've never tested positive for syphilis.
Wonderful, thank you. Because if you do that, just a different lab test that we have to administer, we have to do for that. Because if you've had syphilis and we're treated, and then we let the lab know this, they'll come back as a positive, and like, oh, we need to treat this person again where you really don't have syphilis. So it's a whole different lab result that we do on that.
Got it. Thank you.
Thank
you for explaining that.
And then, okay. When's the last time you urinated? How many hours ago?
It would have been not too long ago. Maybe 3 hours.
Perfect. Yeah. For 2 hours, so that's perfect. And PrEP and PEP. Any need or no of those two?
Okay, so how do I know if I am a candidate for PrEP? Because it's interesting. Places that I've been tested before, haven't asked me because my partners are all female.
Right.
So that being one thing, but if we're also seeing that like HIV is becoming more prevalent in heterosexual relationships too, like at what point should I be considering PrEP?
Well, if you are using unprotected sex, no condoms, and mainly for male to female sex is very, very low risk of the male contracting HIV or anything else, because it comes from your semen, your juice, which goes into the female, so none of their vag juice will come into you, so that puts they're at the they're at risk, but you are low risk.
Thank you for explaining.
Yeah.
I've never had anyone just like tell me.
Right.
Like I would assume, but yeah.
So I mean, PrEP, I would say no. You wouldn't really need, but PEP, PEP, you would. That is Plan B, the emergency 72-hour pill.
Oh.
So if you had an encounter last night, no one talked about status. They called you this morning. By the way, I'm HIV positive, and I'm not undetectable, meaning the viral load has not been suppressed.
Okay.
Then you're like, oh, what do I do now? You go to ER, urgent care. You can say I was exposed to HIV. They will give you PEP.
Okay.
And that's a week-long regimen of pills that you would take, and that would kill any of the HIV virus inside of you.
Got it.
Healthcare providers use that if they're doing labs to get pricked by a needle. That's what they would have to go on immediately to.
I saw that on an episode of like Chicago.
Right? Yeah. So I was like, good for them.
They talked about it.
Yes, we need more of that out here. So that's your emergency 70-hour pill. I tell people that a lot, and we've had a lot of people come in and say, thank you for telling me. I actually had to utilize that. So it's great to educate people.
Is this something that you should just have on hand if condoms break, if they slip off, if there's unprotected oral sex?
Yeah. Then you could just go. You wouldn't keep it on hand. It's something you would have to go and get a prescription and get right there and then. Yeah.
Okay.
Yeah. Then that's where you'd be like, okay, I had some exposure. I need some PEP. Yeah.
So PEP is essentially Plan B for HIV.
Correct. Yes.
Okay.
Yeah.
And with these exposures, I guess, would females need to? Is this something that they can utilize?
Yes,
as well?
they can. PrEP and PEP, both for females. Before PEP, PrEP was just for male and sex sign at male at birth, but now there is PrEP for women too as well. So they just got that.
So all I see in the marketing tends to be more male identifying people.
Correct, because they're the ones who are higher risk. Yes, we are.
But here's the thing. So what I'm noticing is that women tend to, and I'm generally speaking, women tend to be more on top of their sexual health, whereas men aren't. So the marketing to men saying be more on top of your sexual health, I wonder if there could be some sort of a messaging for women to make men be women who have sex with men to make them more on top of their
mainstream right now. I wish they would be. I wish they would say PrEP is for all rather than just because since it is higher prevalent in men than women with HIV. So that's why they're concentrating more on MSMs. Yeah.
Okay.
Men having sex with men. I wish they would just pull out, but we'll get there. We're getting there.
We are. We're getting there.
But right now we're just worried about the men having sex with men.
Yeah. Okay.
Right. And okay. So that's all the questions we got today on this. Any questions on those questions?
No, I don't have any right now.
Okay. So, like with my risk assessment, you're really low risk for a lot of the STIs and stuff. But
I'm real low risk. No.
All right. So now we come to the other tests. The syphilis, gonorrhea. Well, not syphilis, but the gonorrhea and chlamydia, since you've already done syphilis.
Okay. And out of curiosity, so I had a partner tell me that she had tested positive for trick, and so I reached out. I was like, all right, well, she told me that she's positive for trick. And then I reached out to try and get a trick test. Do you all not test for trick?
We don't.
Okay.
Yeah.
All right.
Community Health Center probably would. Planned Parenthood would be a place to go to for that. Correct.
Okay. Now, with someone potentially being exposed, let me re-ask that. With a potential exposure, let's say a partner reaches out and they're like, hey, I was recently told by a partner or I was recently exposed to X, chlamydia, ghonnorea, syphilis, hepatitis, HIV. What are the practical next steps?
Well, they're going to want to come in, get tested for sure. And then if there's a positive test, what we also do, we work with Multnomah County. So a lot of times they will get the information and they will call the client and talk to them about partners and contacting ex-partners, past partners, and letting them know about that as well. Sometimes the county will get involved and just go ahead and call those ex-sex partners that were involved if they can get a hold of them, just to make sure that everybody's been treated and tested.
Okay.
Yeah.
So they don't have to say, like, call someone and say, my name tested positive.
No,
it's,
no.
Hey, y'all do this for me.
Right. Yeah.
Okay.
Yeah. We can do that for you, but also we want you to be, responsible and call your sex partners too, and also tell them that you had exposure, you test positive, they could possibly, and they should come in and get tested.
Got it.
With us. Yeah. All right. So here's the next test. So this is going to be the urine test.
Okay.
It's called a dirty catch. You pee into this
It's
directly.
called a what?
It's called a dirty catch. That means you don't pee in the toilet first. You pee into this directly because that's where all the bacteria likes to hang out. Is at the end.
Okay.
So you don't have to fill it up. You're about this far because I'm going to transfer some of it into another vial.
Okay, so about halfway.
Yeah, about halfway is great.
All right.
And this is your throat.
Okay.
All the way very
Talk
back.
to me about the throat swab.
Throat swab, this is what collects is your oral gonorrhea and chlamydia. So you want to take this swab, go all the way back in your throat where your tonsils are. It used to be a couple times. If you gag, that's a good thing. You're going to take this tube, open the tube up, put your swab in there, snap it off, and then put the tube back in, and that's all it goes. And it goes sealed down.
I'm finding that healthcare providers aren't telling people about the swabs.
Yes. And people with rectal swabs, they don't realize that if you do a rectal swab, you can wet the tip rather than doing a dry swab too. So that's a lot of misconception people don't know about. So yes.
Or you heard it here first, folks.
Right. All right. So
Okay.
we're not doing a rectal swab for you today.
Okay.
So because you're low risk on that. So we'll do the throat and then the urine test.
You got it.
Ready?
Yep.
Take this back to the
Oh.
restroom.
All right, I'm gonna take this with me.
Sure.
So y'all gonna hear some walking along the way, footsteps, doors opening and closing. It's so quiet. Oh, it's Saturday. I didn't know y'all were open today.
Clinic's open. Yeah, they're closing Saturday. The clinic is.
Okay.
But we try to accommodate people's schedule like Monday mornings, Saturday afternoons, and Tuesday evenings.
Oh, so those are like hot times.
Right, yeah. All right. And here you go. When you do those, bring it back to me, and I'll be right here with you.
All right. All right. I am removing my mask so y'all can hear me a little better. I don't know if y'all need to hear me. Oh, I dropped my file. So we got a little bit of an echo. I'm gonna do the oral swab first. Cracking this thing open. Okay. Y'all get to watch me gag on stuff. If you're watching whatever the TikTok video that I'm making for this looks like. I hate this part. Okay, here we go. All right, I'm doing my oral swab testing at the back of the throat. He said if I gag, that's a good thing. This is so terrible. Swabbing. Oh my God, I'm gonna stop this. Let me pause this podcast. All right, we got it. Okay, so now I am removing, hold on, let me see. Removing the top of this here little thingy-majig. Sticking my Q-tip into the fluid, putting the cap back on. Oh wait, I'm supposed to break this. I almost messed up. And putting the top on. Bam. Oral swab done. Okay. Now let me pause this while I pee in the cup. Y'all don't need to hear me peeing in the cup. All right, cool. Y'all did not need to hear me peeing into this cup. Nor did you hear me break the toilet. All right, back to it, opening the door, coming out. All right, here's my urine sample, Rob, and my throat swab.
Wonderful. Let's go back to the room.
All right.
Get some results.
Whoop, whoop. Walking back in, we're walking in. Okay, so I'm looking at the wall and I see Prism Health, pivot testing.
Right. We're all under the same company under Cascade Age Project.
Got it. Got it. All right.
It's confusing. Right. And we are actually opening a second location.
Oh, where's this going to be?
North Portland.
Nice.
Off of Williams. Because we're trying to make sure we have access for lower communities that don't want to come into this part of town in their neighborhood. So we're trying to have more access, local access for that. Yeah, it's wonderful. Alrighty, now your test results.
All right, let's talk through the test results and like what this looks like, what this means, and then we will go from there. I am ready for you.
Alright, so your Hep C test came back negative. This is a control line, meaning the test is working properly, a red line. If you had antibodies, it would be another line there, which there isn't.
Okay.
HIV test came back negative.
Okay.
Control line properly working. If you had antibodies or antigens, there'll be a line in one of these spaces just like that line.
Okay.
So that line's correct. So everything's correct there. Any questions on those two?
No.
Awesome.
And if I were to have tested positive for HIV or Hep C, like what would the next steps have been?
For HIV, I would do a blood draw to send that to a lab to make sure it's confirmatory, because sometimes there can be a false positive on these tests.
Okay.
It rarely happens, but it does happen. So we would do that lab, and then that next, we would connect you to services at Cascade Age Project with CareLink navigators into medical care. If you don't have medical care, we have insurance navigators. They'll get you on insurance to help take care of this. Medications and primary care work as well. So we'll make sure that you're covered, definitely, if there was a positive.
All right.
Yeah.
Thank you.
Yeah, you're welcome. And yeah, the whole process takes about 30 minutes for this whole thing.
That's exactly right. I mean, we came in, we talked a little bit, and here we are about 22 minutes-ish into the podcast. But this is how easy it is. It's very easy to come in, just get tested, or to make the appointment. Do you accept walk-ins? Do you have space?
Currently, we don't. Because of COVID, we can't have a full lobby.
Got it.
So it is by appointment only, which is great, because that means you don't have to wait for 3 hours in the lobby. You can just come in 10 minutes before your appointment, and you're there. You're guaranteed a spot for sure.
Okay.
Yeah, so we're going to keep that model that way.
All right. If someone has a potential exposure or confirmed exposure, do they get like expedited treatment, or do you encourage them to go to an emergency room? What should you do?
I would encourage them. Again, I would ask to see if within 4 weeks of exposure. We can't test until 4 weeks of that exposure. So they would definitely want to wait 4 weeks regardless. If they came in 2 weeks, we can get a false negative. They could be positive, but it takes about 4 weeks for the antibodies to actually get into the body and infect, for us to be able to test and show up on a test.
Got it.
So I say wait 4 weeks. I know it's hard to do that, but to be tested, yeah, this is the best way to do it.
Okay.
Yeah.
Great. Anything else you want to mention here about Pivot?
No, Pivot. Again, it's free testing for all. No insurance needed. We won't turn anybody away. We have a condom wall, free condoms, free.
I need to re-up. Yeah.
Right.
So that tells you how sexually active I've been since last time I was here. Definitely need more condoms. So I didn't bring my book bag. It's from my little fanny pack.
Oh, that's fine. Yeah. Fill that up. We have plenty of supplies, so it is expensive out there for that.
It is.
Yeah. So I was just in the store the other day. So I encourage a lot of people to come into you don't need an appointment. You can just walk in the lobby, say I need condoms, and just go to the condom wall.
I love it.
Yeah, it's open to all.
Okay, great.
Awesome.
Well, thank you so much, Rob.
Yeah,
I appreciate you
welcome.
making the time and getting me in here to stay on top of my sexual health status and be aware of what that is. Everyone listening, I encourage you to just, if you may not be here in Portland, then you can just search free STI testing near me, and you'll likely find your version of a Pivot. And check them out. Let me know what you think of them. As you know, we are putting the directory together for places that people are endorsing and saying they had a good experience with getting their STI testing done. And also, I don't know, do you have people who come in with their partners at all?
We do. We do. Yeah, we can test them together, but sometimes we like to test them apart. It's just easier. But yeah, partners come in anytime. Yeah.
Okay. And then, do you provide any kind of sex education at all?
A little bit. We can talk about sex. I've had somebody who's newly into the gay world, into anal sex, and want to know about how that worked. And I'm great talking about it. Be protective. Mm-hmm. If you don't have a condom, you can use a female dam, barrier dam for that as well. So there's many different ways you can have sex and be safe, right?
Okay. Great.
Yeah.
All right, thank you so much. And that concludes this episode of Something Positive for Positive People. Please like, rate, review, subscribe to, share this podcast, and know your status. Till next time, stay sex positive.